Good evening. This is All India Radio Kohima. I'm Jonas Yantan with evening news. The headlines. Prime Minister Modi says country moved from approach of women development to women-led development in the last 9 years. Manding Yantan sworn in as Pro-Tem Speaker of the 14th Nagaland Legislative Assembly. Union Health Ministry keeping close watch on seasonal influenza situation in various states and union territories. And Centre announces 10% reservation for ex-Agniveers in BSF recruitment. Now the news in detail. Prime Minister Narendra Modi has said that the country is moving ahead with a vision of women-led development. He said with a continuous focus on women empowerment, the country has moved from the approach of women development to women-led development in the past 9 years. Virtually addressing the post-budget webinar on economic empowerment of women today, Modi said Nari Shakti is playing a pivotal role in increasing the speed and scale of the country's progress. He said women's participation is increasing in every field and now they are leading in several sectors. The Prime Minister said this year's budget will further boost the efforts taken in the direction of women-led development. Modi reiterated that the country is moving with the spirit of Sabka Saath, Sabka Vikas, Sabka Viswas, and Sabka Prayas. He said India can move forward only by raising the levels of respect towards women and bringing the sense of equality. He also expressed happiness over the election of 2 women MLAs in Nagaland. Modi urged the people to move forward with a determination to remove every obstacle coming in the way of girls and women. Manding Yantan has been sworn in as the Pro-Tem Speaker of the 14th Nagaland Legislative Assembly today. Nagaland Governor La Ganesan administered the oath of office to Yantan at the office chamber of the Governor in Raj Bhavan, Kohima. Chief Secretary J. Alam, DGP Nagaland Rupin Sharma, Home Commissioner Abhijit Sinha and other officials were present during the swearing-in ceremony. Yantan was appointed as the Pro-Tem Speaker by Governor on March 7 and he will discharge the duties of the Speaker of the 14th Legislative Assembly until a Speaker is elected by the Assembly. Union Health Ministry is keeping a close watch on the seasonal influenza situation in various states and union territories through the Integrated Disease Surveillance Program network on real-time basis. In a statement, the ministry said it is also tracking and keeping a close watch on morbidity and mortality due to the H3N2 subtype of the seasonal influenza. The ministry said so far Karnataka and Haryana have confirmed 1 death each from H3N2 influenza. Young children and old-age persons with comorbidities are the most vulnerable groups in the context of seasonal influenza. Indian Council of Medical Research has also issued advisory for infection prevention and control. It has suggested to the people to wash hands with soap and water, and symptomatic patients have been advised to wear masks and avoid crowded places. They should cover mouth and nose while sneezing and coughing and avoid touching eyes and nose. Such patients have been advised to take plenty of fluids and in case of fever and body ache, they can take paracetamol. They should not take antibiotics and other medicines without consulting a doctor. Health Ministry said that oseltamivir is the drug recommended by the World Health Organization and the drug is made available through the public health system free of cost. The central government has announced that 10% reservation will be given to ex-Agniveers in the BSF recruitment. In a notification issued by the Home Ministry yesterday, the government has amended the recruitment rules of the Border Security Force. The amended rules state that ex-Agniveers will be exempted from the physical efficiency test. The government has also announced that the upper age limit will be relaxable up to 5 years for the candidates of the first batch of ex-Agniveers. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on News on Air app and YouTube channel AIR News Kohima. The online registration period for joining Indian Army as Agnivir has been extended by 5 days up to 20th of this month. In a press release, PRO Defence Kohima said candidates can register themselves using their Aadhaar card or Class 10 certificates. It said all registered candidates will need to undergo an online common entrance examination during the first stage of recruitment. The press release informed that there are 2 examination centres in Nagaland and 3 in Manipur. Indian Army has granted substantial bonus marks for sportsmen, NCC certificate holders, and ITI qualified candidates in the selection. For any queries or guidance, interested candidates may visit the website www.joinindianarmy.nsa.in or contact Army Recruiting Office at Dimapur on 03862 249012 and 8974958673. Commissioner and Secretary Health and Family Welfare Y. Kiketo Sema said implementation of National Health Mission in Nagaland has brought in overall improvement in the state's healthcare delivery service. Sema said this at a mid-term review of NHM for Nagaland in New Delhi today. However, he noted that over the years, only 50% of the centre's approved budget could be availed due to delay in contribution of the state's share. He said a short receipt of grants has not only affected the mission's implementation but also timely disbursement of staff's salary. He appealed the Union Health Ministry to consider releasing subsequent installments even with a pending state share. Sema also requested release of the approved budget in 2 installments instead of the present practice of 4 for small states like Nagaland. In view of the fire incident at Mau Market and NM Market on 27th of last month, Deputy Commissioner and Chairman DDMA Kohima Shanavasi has informed the general public that the building concerned is unstable and unsafe for human occupation. In an order, the DC stated that violators will be convicted as per relevant section of the Disaster Management Act 2005. The order comes into force with immediate effect. All Nagaland College Students' Union ANSU is seeking exemption of colleges affiliated to Nagaland University and autonomous colleges in the state from the Common University Entrance Test CUET for the academic year 2023-24. The union appealed the state government to request the University Grants Commission and Union Education Ministry for the exemption and allow students to take admissions as per existing practice for this year. In a letter addressed to the State Chief Secretary, ANSU acknowledged the benefits of CUET but lamented that Nagaland still had operational difficulties to implement the test through online mode given the lack of proper digital connectivity in many parts of the state. It claimed that many of the identified test centres in Nagaland were not operating and there were no centres in some districts, especially in the far-flung areas. Additional District Magistrate ADM Sibsagar Assam has reinforced night curfew in the 5-kilometre belt in Assam side of Sibsagar district bordering Nagaland state till 25th March. In an order, the ADM said night curfew has been imposed from 6 p.m. to 6 a.m. as a precautionary measure to prevent occurrence of anti-social elements, extremist and unlawful activities coming across the Assam-Nagaland border in the belt of Sibsagar district. The order prohibits movement of any person or groups of persons or any vehicular traffics during the period of night curfew. However, security personnel, Army, CRPF, police and civil officials deployed on duty have been exempted from the purview of the prohibitory order. And now to the news, here are the main points again. Prime Minister Modi says country moved from approach of women development to women-led development in the last 9 years. Madanyantan Sonin as Pro-Tem Speaker of the 14th Nagaland Legislative Assembly. Union Health Ministry keeping close watch on the seasonal influenza situation in various states and union territories. and Centre announces 10% reservation for ex-Agniveers in the BSF recruitment. That is all we have in this evening news bulletin. Good night.